How concerned are you about the next phase of what President Trump wants to do?
I think the most important thing is to step back and for us to have a broad discussion about the future of healthcare, which is happening organically in the political arena anyway. And I think it's this, what we're doing, Vonnie, is going back and forth. What is the role of government? That underlies the whole discussion. And that's a fine and actually a fair question to debate. For us in the healthcare sector, it's important for us to step forward and demonstrate what we're doing, why we are worthy of the trust of the American people, what we're providing, how we're providing access, and what we're doing to reform, restructure, and transform the healthcare industry, which is what I think consumers want to hear.
Sure, that's all very well and good, but if Congress decides to do something, or if, as the President says, all three branches, legislative, executive, and so on, will be in Republican hands next time round, then does it matter what the healthcare sector is doing? Won't it be legislated?
Well, I think that we have seen some legislation thus far. We've seen some regulation, and it's important for the sector to respond to that. We've responded to that. We've put affordable products in the market. People have responded to that. There's a little bit of an overhang, however, with respect to the ACA. Are people required to participate? As health plans, we are required to make our product available, but we're seeing now some people not participating, which has an impact on cost. And that is to say, some of the younger and the healthier people are beginning to not necessarily participate. And that forces the cost up for everyone. That's a discussion that we will have in the context of the forthcoming presidential campaign. But it's important for the industry to step forward to say what to do about that. States have stepped forward. New York State has stepped forward. New Jersey, Connecticut, other states are stepping forward and actually filling that gap and defining those answers.
Well, you're actually the largest not-for-profit insurer,
yes,
representing 3 million in the tri-state area. So what are you saying then?
What we're saying is it's important to step forward and provide some opportunity to give people a roadmap. Some of the things that
What does any of that mean?
What it means is that it's important for people to understand that there is a route to reducing costs. It's to get everyone in, to have the younger and the older people involved in a pool that actually puts the costs where it should be. It balances them. Right now we're a little out of balance, and I think that's what states have done, and certainly New York State and Connecticut and New Jersey in our tri-state area, they are wrestling with this very productively, which is very good. And our job is to provide the information and the data to give them a roadmap for what they can do to solve some of these problems.
It strikes me, though, that you are bound by what the legislation is. So if there were to be, for example, an upset, and one of the more left-leaning Democrats were to win the presidential election next time, then you would be looking at something very, very different, right? You might even be looking at, a radical overhaul. You
can always be in the future looking at something very different, and our job is to respond to the here and now and prepare for the future, whatever the externalities might be. And that's what we're doing. We're putting products in the area to actually change the focus, to put the focus on value in the healthcare system as opposed to volume. We've had a fee-for-service system, so it's been a piece rate system. We're switching that, we're changing that, and we're working with our provider partners to do that.
So is there anything wrong with the ACA as is?
Well, the ACA was laid out to actually get more people into the system, and it did accomplish that. Some of the recent changes in Congress have made it more difficult for individuals to actually achieve that objective. And so what states are doing is they're stepping forward and looking at what they can do to ameliorate some of these impacts. And that's where we are right now. Now, what happens, per your question, in the future is quite another thing entirely, and nobody really knows what's going to happen. What we have to deal with is the here and now, prepare for the future, and bring into the delivery system a way of getting the most people in, getting the costs down, and improving the quality. It's that triangle of issues.
And drug pricing,
Drug pricing is a very significant challenge, without a doubt. The prices are too high. And at some point, we have to have a more direct discussion about what is driving those prices, why are they so high, and what to do about it. And one of the things that worries me is that we're talking around that and talking about everything but the fact that the prices are too high. They're being set too high. And the political system, I think, will get to a very robust discussion around that.